Hey guys, Dr. Nova back here again with another video requested from Samantha. If you all recall, Samantha is a master's in exercise physiologist who also is a strength coach, and she practices over on an online fitness forum now called Fuel for Fitness. More information for Samantha's Fuel for Fitness page will be found in the shared area, as I'm going to share this video onto her Facebook page where you can find her and other videos that I've made as well. Now, this video was put up following the birth of this beautiful baby boy named Isaiah, and some questions that Samantha had in terms of moving forward following a cesarean delivery. Without further ado, let's go on to the rest of the video. Now, the number one thing to assess following a cesarean and/or vaginal delivery is the presence of a diastasis recti. In this image, you'll see that on the image on the left, this is a normal abdominal presentation with the rectus abdominis and the linea alba intact. On the right side, we see an image here where the linea alba has been distorted, giving way to some of the connective tissue under it, and this is known as the presence of a diastasis recti. In this presentation, if we are positive for it, then there are some steps that we will take to address it, but nonetheless, most of the rehab is pretty straightforward within the first couple weeks after delivery. So here is a way that you assess having a diastasis recti. So one hand is going to be placed at the top of the linea alba and the bottom hand below. The head is lifted off the ground, and you're basically assessing for the exposure of the connective tissue underlying the linea alba. The assessment is also then done by checking the width. So a 2-finger width is considered normal, and a 4-finger width or anything above 2 fingers would be considered having a positive presentation for a diastasis recti. Here's just a different shot of me assessing the same thing. There would be a subsequent head lift, as you see there, and then we're assessing basically how far down does this diastasis recti go if there is a presence of it. And again, it's evaluated also by width, so how many finger width. Again, 2 is considered normal, 2 is good, right? 4 is considered a diastasis recti. Following the positive findings and or not, still using a log roll technique after a cesarean delivery is very important, as well as abdominal bracing for rising from sit to stand, just to make sure that things stay intact. The initial rehab following either, again, presentation or not, would be to activate the transverse abdominis, so I'm just trying to bring the navel to the spine. These are about 3 sets of anywhere from 8 with about a 10-second hold, and as well using a TA activation and posterior pelvic tilt. Now, in the presence of having a diastasis recti, you do want to protect yourself. So here I'm using a towel, and the towel is being placed around the back end and crossed over the front so I can actually aid in some external bracing. Here you're going to see me just tighten up that towel. Right, and this will allow me to perform some of the other exercises, such as a head lift, right, or McGill curl up, which should be done with the towel in the presence of a positive diastasis recti. Now, if we've got a Swiss ball with us, we're also going to want to use this to help to brace the abdominal wall to not further damage the diastasis recti if present. Nonetheless, though, we can use a Swiss ball to do some alternating arm lifts, some alternating leg lifts, and as well some extension exercises for the lumbar and erector spinae and multifidi of the back. And we can also then progress to some bird dog exercises with alternating arm, right, and leg. Now, we do want to also make sure that we're focusing on some good scapular and shoulder stability, because since most of our loving mothers are going to want to hold their babies all the time, they tend to kind of stay in a forward flexed position. So lots of anterior tipping and changes occur at the shoulder blade. So here's just a progression, again using the ball to aid in providing some abdominal assistance for scapular stability. Now, sitting on the ball and providing some external cues to the rectus abdominis, we can definitely start working on just integrating some of the pelvic floor, doing some pelvic clocks or pelvic circles, some posterior and anterior tilting, so that we're kind of reconnecting down into those muscles, and as well doing some seated marches. Again, just to get some graded exposure to what we're doing. And all this should be relatively pain-free. Now, aside from general exercises, we're also going to want to do some soft tissue work, such as this cross friction, finger over finger, onto the scar, to just start getting that tissue more compliant and pliable. Here I'm using a bit of a pinching technique just to elevate that scar off the underlying muscle, so any adhesions that are forming under there will kind of adapt and mold themselves accordingly. Here's also now a horizontal pinch to pinch, using again a finger over finger approach to just protect your hands. Now, another good technique for aiding in the compliance of the scar that's over the cesarean incision is going to be to use some kinesio tape. So in this image I'm using a piece of regular tape, but the concept is the same. You're going to want to apply the kinesio tape on a bit of a stretch, place it, and then let it retract. Again, stretch it, place it, and let it retract so that it elevates some of the scar. Here I'm going to use some SMR or self-myofascial release techniques. I picked these up over through John Russin. Here's one that is focusing on a medial and lateral hamstring release using a 4-finger approach. Here another 4-finger approach into the right into the greater trochanter to work the piriformis and some of the external rotators of the hip, which usually get pretty tight from just lots of sitting from nursing and so forth. Now again, from holding the baby a lot, we're going to find some tightness in the lat and in the pec minor. So here's an SMR latissimus dorsi release. Okay, again using a 4-finger and just finding that spot of tension and then using some active movement around it. Here's a finger over finger approach onto pec minor. Remember, you're going to want to palpate underneath the coracoid process. You'll find it, you'll know it, and then you're going to want to do some shoulder flexion, external rotation, and some breathing, as it is an accessory muscle for breathing. It will become a little bit more apparent when you do that. Also, we're going to want to work on some postural setting. Here is a inferior trap scapular retraction exercise. Notice I'm palpating the trap and the lat to make sure that they're not on and that really most of the contraction is being taken up by the inferior trap. That's just some cueing. Here I'm doing it with some cervical retraction just to turn a little bit more of the posterior chain and just come out of that forward flex position that most of us get into from just holding our kids when they're so little. Now in the case of headaches turning on, this is just a towel self-assisted traction to the neck. So I'm performing a chin tuck against that towel, and that just gives us some good spacing in the back and should stave off any headaches from coming on. I hope you guys liked the video. Leave any comments below, and definitely check out Samantha on her Facebook page over at Fuel for Fitness. And happy lifting.